How many of you have heard of tech neck, forward head posture, anterior head carriage, or an anterior translation of your neck? That's essentially what a lot of us are doing nowadays because of the environment that we live in. We have cell phones, we have computers, we have a lot of stuff that's done in front of us, and it draws our head and pushes our head forward, rounds our shoulders. Did you know that according to the World Health Organization, you have significantly increased risk of mortality just with having your neck in a forward position? That means that if you have that tech neck or that anterior head carriage, you statistically are going to lead a shorter life compared to somebody who doesn't. Now, why is that? Well, when you have that forward head posture, it puts stress and tension on your spine, on your nervous system. It decreases your lung capacity. It puts stress and strain on those blood vessels in the front of your neck. Not even including the fact that you get symptoms around that. You get headaches, you get shoulder issues. So there's a lot of things that can happen when your head starts to come forward. It's not just, hey, I have bad posture. There's actually a significant risk that's involved there. So today, if you're not sure whether you have that forward head posture, that tech neck, today what we're gonna do is we're gonna do 2 tests, okay? So I want you to take note, just in a neutral position, wherever you feel comfortable. I'm gonna have you go ahead and look all the way up. As you look all the way up, take note of your range of motion. Take note of how you feel. If you feel achiness, pain, tension, as you do that motion, that's something to keep in mind. So what I want you to do now is come back to straight ahead, tuck that chin back, and then go ahead and look all the way up. Does that increase your range of motion? Are you able to do more? Does it feel better when you do that motion? You can also do the opposite of that. Jut your neck forward, so that way you can see, as I bring the head forward, what does that actually do to my range of motion? So with my head forward, I'm gonna go ahead and look all the way up as far as I can. Now I'm only getting maybe 45, 55 degrees or so here, and I can already feel the muscles in my throat. You can probably hear it in my voice. The muscles in my throat are starting to tense up because of that extra pressure that's there. Now the other thing we're gonna do, the other test, is gonna relate to the shoulder, right? Because if we get that anterior head carriage, that head comes forward, nobody's walking around with their shoulders back like this, everything follows suit. So our shoulders start to round in, our hands will start to basically flatten out in front of us, our thumbs start to point towards each other, which is not great, right? This isn't a good look, this is. But you can basically start to feel that. If you take pictures, look at those, see if you're actually standing like that. But in regards to this test, again, start with a neutral position. Just go ahead and bring your arm straight forward all the way up. Take note of where you're at. Go ahead and bring that down. Now tuck everything back. Tuck the neck back, tuck those shoulders back, and then repeat that test and see how much further you can actually go. And again, you can do the opposite of that. Check and see, as we round those shoulders forward, how much range of motion I can actually get without having to change my posture. It's pretty significant. So if you are somebody who, as you go through those tests, you feel that restriction, that reduced range of motion, or you feel pain or discomfort, anything that just doesn't feel right, give us a call. Come on in. Let's help you diagnose that, and let's figure out how we can get that fixed. So that way we can get you feeling better, functioning better, ultimately living better. See you soon.